So thanks for joining us, everyone. If you're watching this recorded on YouTube, you can join us live next week on Zoom. So just go to bartonwebinar.com, click the appropriate links, and you can get registered, and then you'll get an email notification, and you can join us on Zoom. And that's where you get to ask your own questions all about anything related to type 2 diabetes. And so the other thing I wanted to tell you about is we also have another webinar. Every other Tuesday, we have a webinar with Dana Cushing, and she is a awesome health coach and nutrition person who we've been working with. She actually lives nearby us, and we've gotten to know her, become good friends, and we do that as well. So Tuesdays, you can register at bartonwebinar.com. We've got plenty of room over there as well. And yeah, I think we just had one 2 days ago, so it'll be in 12 days from today. On, what is that, the 31st? That's my 25th anniversary, so I might not be around that day, actually. But anyways, go register for that as well. We got all sorts of free opportunities for you guys because we want to help you live your best life. So, Dr. Saunders, today we were going to get
recording
started.
In progress.
We're recording now. Fantastic. All right. So today we wanted to talk about, we wanted to get a little bit of update on the world around us, immune systems, COVID, good stuff like that, masks, all that. Could you give us an update on that and then transition into the type 2 diabetes discussion?
Okay. So I've when this idea was brought up for this topic, I was like, okay, do I talk about the political part of it or the health part of it? Because they're two very separate things. There's a lot of politics involved in the pandemic, and not a lot of health. So people aren't talking about the health; they're talking about the politics of it. So should you get a vaccine or should you not get a vaccine? Well, politically, you should get a vaccine. And so that's the way I look at it, because I work in a nursing home, and I see that the risks of the vaccine are this, and the benefits of the vaccine are this. So I look at it as the risks outweigh the benefits, and therefore I would not normally, for health reasons, get the vaccine. But for political reasons, there's other reasons to do it. So if you have to travel somewhere and you need the vaccine, okay, then that's a political reason to get the vaccine. For me, I'm medical director of a nursing home, and the administrator says, look, if our medical director won't get the vaccine, how am I going to get the nurses to get the vaccine? And we have to have 70% by the end of this month and 100% by September 30th, according to the state of California. So to get vaccinated. So I'm getting the vaccine. I'm going to get it. And I know it's risky. I know. Well, you know what? Life is a risk, and you just take risks, and you do the best you can with what you have. And people have taken risks for centuries, you know, but when people are called into battle to go to war for their country, yeah, well, that's a risk, you know, and for what? Well, because somebody didn't like somebody else higher up, and you're going to go and kill innocent people, and that's it's always been a problem, and that's, you know, for since the beginning of time. So this is some things you just have to do politically, even though it's not for health reasons, it's politically expedient. So you have to do it, and so that's where I find myself. And so I can't make decisions for any of you to say what's the best way to do it, but I can talk about the health reasons and the health things. So there was a study done in Massachusetts, and they looked at the outbreak of the coronavirus in Massachusetts, and they found about 70% of them were people who were vaccinated. And they're like, what the heck? The vaccine doesn't work at all. So the CDC said, okay, whether you're vaccinated or not, you have to wear a mask. So, you know, people were told, well, if I get vaccinated, then I don't have to wear a mask anymore. And they said, well, the vaccine doesn't work. So if you're vaccinated, you still have to wear a mask because you're still likely to get it and spread it. So they said, well, the vaccine doesn't prevent the illness because vaccines generally don't prevent you from getting the illness, but they do prevent you from getting super sick and getting into the hospital. Well, it turns out that's not actually correct either. It turns out they're asking us to get a 2-year-old flu vaccine, and the current influenza, the current epidemic of influenza, which is really coronavirus this year. But there are other ones going on. Respiratory syncytial virus is going around, which actually tests positive on your COVID vaccine, COVID-19 test too. So the test is kind of wishy-washy too. You're not sure if you have coronavirus, COVID-19, or respiratory syncytial virus, because either one of those viruses will come up positive on your test. So, but either way, those are flu viruses. Those are influenza, annual ILI, influenza-like illness. So, if you have the vaccine, you have a vaccine against a 2-year-old virus. We already know there's at least 5, and there's likely many more, but there's been characterized 5 different strains of this coronavirus that the vaccine doesn't help at all. Everybody's worried about the Delta variant, and they forgot that there's an alpha, beta, gamma, delta, delta, gamma, and lambda. There's a whole bunch of variants out there, and the vaccine doesn't help for any of them. And so they're telling people, well, get a 3rd shot. Well, a 3rd shot of a 2-year-old vaccine is not going to help this year's strain. It's ridiculous. That's why they had to have flu shots every single year. People were getting flu shots every single year because it changes every year. All the flus do. Why? Because they have a reservoir among like animals and humans, and they go back and forth. And so their proteins change, and they change enough that the antibodies that you made from the vaccine a year ago are no longer any good for this year. And of course, we know that. That's been characterized, it's been done. And yet they're still asking us to get a vaccine from a 2-year-old virus. It makes no sense for your health. It's not a health thing. This is all just a political thing. So expediency is another reason for doing things, and not necessarily because it's the best. Now, you should know that there are risks and benefits. The risks of the vaccine itself are about 2.7%, according to the CDC. But if we look at the VAERS system, the Vaccine Adverse Event Reporting System, it looks like it may be much more than that. And that even underestimates by 90%-ish. It depends. There was one study at Harvard that said the VAERS system, the Vaccine Event Reporting System, it reports that they get reports for about 1% of the total number of vaccine adverse events. So we may be looking from 10 to 100 times what is reported, in which case we're looking at, people are dying from the vaccine. A lot of people are dying from the vaccine, and people are getting sick from the vaccine, and they have permanent damage to their heart. Young, healthy people are getting permanent cardiomyopathies from the vaccine. And so what was thought to be really rare, it turns out it isn't as rare as they thought. So there are risks to it, and what your risk is, you could do a percentage, but what does a percentage mean to somebody who has heart damage or who's lost a family member? I had one of my patients. She came in and she told me her nephew and her uncle. Her nephew died 1 week after getting the vaccine, and of a cardiomyopathy, and then his father, her uncle, her brother, died. His father died 2 weeks after getting the vaccine of a blood clot. So there are risks, and then what are the benefits? Well, getting an old vaccine, a 2-year-old vaccine, you've lost all the benefit, because now the coronavirus has changed enough. You have enough different strains that you're talking about something that's not working anymore.
Hey, Dr. Saunders. So this issue is definitely polarizing and divisive in some ways, and like a lot of what you said is true, but we're not hearing it in the mainstream media. So the media is constantly telling us, like, it depending on what you watch, but especially like CNN, they're constantly like shaming people for not getting the vaccine and talking about how that's the only way to be healthy. And it's like there's a lot of misinformation, and like it's maddening to me, but there's people that actually think that, if you're not vaccinated, you're killing people, and it's ridiculous. And so where can we do our own independent research to find like what is truly going on here? Because we have someone commenting here that's saying that you are sharing misinformation and disillusion and stuff. It's like, okay, fine, I know there's millions of people that feel that way or whatever, but like, how do you get to the truth of what's really going on here? Or can the average person like me?
You don't have to go much farther than the CDC. So there was a reason the CDC said that people who are vaccinated have to wear masks. And essentially they said because the vaccine doesn't work. So the government is saying this. This isn't something I made up. I have an urgent care, and at the urgent care we have about 50% of the people that come in with positive COVID-19 tests are vaccinated. So it's a 50-50. Well, about 50% of the population is vaccinated. So it's not any different. It's not. There was one claim that people were getting worse because of the vaccine, and that's not quite right either. It's probably just not effective.
Yeah. And masks themselves are questionable on if they're helping.
So there's a really good source for that. The FLCCC, the frontline doctors, have put together on their website. They have all kinds of the studies that were done, the studies that the NIH did on masks, the studies on the vaccines. And what's really cool about this is they put on there what to do about it. The studies that actually help. So something you can do for people to prevent and to treat the COVID-19, so that you actually have something of benefit rather than what the everybody's crazy ideas. And so that would be a very good source to look up to get that information.
What do you recommend now as someone who has had COVID, and I worked with you, you're my doctor, what do you recommend, which I know what you're going to say, for people who do get COVID?
Okay, so if you have it, ivermectin is clearly an antibiotic that is just about, if you get it at the right time, 100% effective at preventing people from death and disability after they get COVID. So on the FLCCC website, they explain what the dose is, how it's administered, what you're going to do if you contact it. So, for example, in Brazil, when they did studies in families, if one person in the family had COVID-19 and they gave ivermectin to everyone in the household, they never had one single case of COVID-19 come up. Nobody else ever came up positive or got any illness. So you can do it prophylactically, and they explain that. Or you can do it once you get it, and the treatment's different depending on what it is. And that works very well. In Peru, they had some research with doing every other week, just taking a dose of ivermectin every other week, and over a large population, they didn't have any cases in those that were taking ivermectin every other week. So prophylactically it can be used, and then treatment, it's a different protocol, and so you would take it every day for 5 days. So that's good, but making sure of one thing: make sure you have enough vitamin D. Vitamin D is the vitamin D binding protein is macrophage activating factor. And so that vitamin D is essential for activating the macrophages, or the cellular immunity, so that you can get rid of the virus before it becomes a problem. And when studies are done consistently all over the world, every study done on vitamin D shows at least improvement, and mostly like dramatic results, where in the Philippines, for example, they just looked at ICU admissions in people who were already sick. So people who were already sick, if their vitamin D level was less than 30, they were 85% likely to end up in an ICU. If their vitamin D level was higher than 30, they were only 15% likely to end up in an ICU. There was just a dramatic difference in the number of people who got really sick, if depending on their vitamin D level. The other two things, zinc is a very important part of the immune system. So keeping your zinc levels up so the immune system functions well. And then you can take quercetin, which helps the zinc to get into the cells, and it's used better. And then vitamin C. So vitamin D, zinc, quercetin, vitamin C.
Go ahead.
There was one other thing, and that is in some states, the states, they haven't told the doctors anything, but they tell the pharmacies not to fill prescriptions, and then doctors are looked down upon if they fill a prescription, or if they write a prescription for ivermectin. So it's kind of hard to get it in some states. So one of the things you may have to do, the FLCCC website has ways that you can get ivermectin. And that's, I've had people from all over the country find it that way. So yeah, I don't have special access to it either. You know, I've had plenty of pharmacists say, no, we're not going to fill your prescription. There's no health reason for doing that. It's just a political thing.